Have you ever wondered how some drugs get approved faster, even when they're not completely new? Meet the 505(b)(2) pathway, the FDA's special route that allows companies to bring modified or improved versions of existing drugs to the market, without repeating all the studies. Let's break it down in under 5 minutes. A 505(b)(2) new drug application is a hybrid between a full NDA and a generic ANDA. It's used when a company develops a drug that is not fully new, but not a generic. Either examples include new dosage form, new strength, new route of administration, modified release formulation, new combination of existing drugs, new indication for an already approved drug. In short, it relies partly on existing scientific data and partly on new studies, because it saves time, money, and reduces risk. Under 505(b)(2), companies can use published literature, rely on FDA's previous findings of safety and efficacy, avoid repeating unnecessary animal and clinical trials. This means development can take 3 to 6 years, instead of the usual 10 to 12 years. It's often used for product improvements, like once-daily versions of drugs, safer delivery systems, better stability formulations. Approach usually followed for 505(b)(2). Development includes Step 1. Identify the reference product. First, the sponsor chooses an already approved drug as a reference. This is the drug whose data they plan to rely on. Step 2. Conduct bridging studies. The FDA requires evidence showing that your modified drug is appropriately linked to the reference. This may include bioavailability or bioequivalence studies, PK/PD studies, sometimes small clinical trials. These are called bridging studies. Step 3. Prepare supporting data. A 505(b)(2) application must include CMC data quality and manufacturing, non-clinical data if needed, clinical data bridging plus new studies, literature references using FDA's format. Step 4. Submit the NDA. The sponsor submits the NDA, but because this is 505(b)(2), much of the safety and efficacy evidence is borrowed from previous approvals. FDA reviews it just like a standard NDA, checking quality, safety, efficacy, labeling, risk-benefit profile. Review time is usually 10 months, standard, 6 months, priority, Section 4, exclusivity. One of the biggest attractions of 505(b)(2) is exclusivity. Companies can receive 3-year exclusivity for new clinical investigations, 5 years if it contains a new active ingredient, 7 years if the product gains orphan drug designation. This prevents generic competitors from entering the market during that period. So, in summary, the 505(b)(2) pathway is perfect for improved, modified, or repurposed drugs. It allows companies to innovate without starting from zero, and it gives patients better, safer, and more convenient treatment options. That's all about 505(b)(2) pathway in short. Follow for more drug development insights.